Good evening, everyone, and welcome to our Ask the Doctor session tonight on lifestyle approach to Parkinson's disease. My name is Shelley Korean with SkyPass Foundation, and I thank all of you for being here today. We are so excited for you guys to hear some of this great content that we have presented to us by a very special speaker from UCLA. Also joining me today is Dr. Shilpa Chitnis. Dr. Chitnis is a movement disorder specialist and professor of neurology at UT Southwestern. She also sits on the board of directors for SkyPass Foundation, and she will be moderating our discussion today. Our speaker for tonight is Dr. Indu Subramanian from UCLA. Dr. Subramanian did her neurology residency and movement disorders fellowship at UCLA and currently works there as a clinical professor of neurology. She is also the director of the Southwest Parkinson Disease Research, Education, and Clinical Care Center of Excellence. She also got board certified recently in integrative medicine and is currently designing a training program for yoga instructors who are interested in working with PD patients. Very cool. Dr. Subramanian, thank you so much for being here today. We're excited to hear from you. As I mentioned earlier, Dr. Chitnis will be moderating today's discussion. So Dr. Chitnis, I will hand it over to you.
Thank you, Shelley, and welcome, Indu. Indu's been one of my very good friends for a very long time. And so it's very nice of her to spend this evening with us. So without any delay, I'm really going to pass it over to Dr. Subramanian, and she'll start with her case study.
Yeah, so I wanted to bring you sort of a background case study just to think about the times we've been in, the times we're in now, and kind of highlight some reasons why I think it's important to think about using some of this lifestyle approach to helping ourselves with Parkinson's symptoms, and even those of us who aren't patients with Parkinson's, caregivers, some of us healthcare providers and loved ones of folks. I think many of us can use some of the techniques that we're going to be talking about just in our own wellness and self-care. So we're going to be talking about a patient of mine. This is a patient that I see every day in my practice. I run our Center of Excellence at the VA. I take care of not just the patient, but the patient and in their family and in their environment. So I bring you the case of John Smith, who's a 75-year-old veteran with a 14-year history of Parkinson's. Judy has been married to John for 50 years, and they have 3 adult children, 2 of whom live nearby. Judy has enjoyed playing with 4 grandchildren, ages 4 through 10 on a weekly basis, and she really enjoys that. She usually has help to clean her home for about 4 hours per week and visits with a friend while John has a physical therapy session once per week for an hour. Once every couple weeks, Judy leaves John with one of their children to get her nails or hair done. John has had a decline in his memory for the past 3 years. He has a tendency to fall once per week. Occasionally, he sees things that are not there. Additionally, John has had some depression and anxiety for the past 5 years. He also has significant apathy. I'll be describing to you a little bit about apathy in a few minutes. Judy tries to motivate him to exercise or to visit with his fellow vets at the VA. He has some insomnia, so that's trouble sleeping, and some urge to urinate about 3 to 4 times per night. Since COVID-19, Judy has not been able to see her grandchildren or her adult children except for a socially distanced meeting when her daughter brings groceries once per week. They have not had any physical therapy or exercise class. They have not visited the VA. So this is now, 8 weeks of this? They largely watch news of the COVID crisis for many hours at all times of the day and night. John's anxiety and depression have worsened. His insomnia is worse, and he is more confused. John has been napping in the day and is up at all hours of the night. He has been worse with his compliance of his medication. He takes multiple Parkinson's medications multiple times a day. And this is his sort of schedule is completely off. His balance is worse, and he has some more near falls at his home. Judy is also having some anxiety now. She's finding it difficult to sleep at night. She is exhausted. She's been drinking more wine than usual as a coping mechanism, and she's doing this every night at this point. She worries that if something happens to her, that there will be no one to take care of John.
So, Dr. Subramanian, this is a question that always comes up from the spouses of patients, and whether the patient is depressed or they just not motivated, they don't care, and we always hear about this word called apathy. And so perhaps you can tell us what's apathy, and how is it different from depression?
Yeah, So apathy is quite a common symptom in Parkinson's disease, and it's basically a lack of motivation or interest. I think in some studies, up to 40% of our patients have apathy. There's a diminishment, so there's decreased goal-oriented behavior, and patients often have a dampening of their emotional expression too. So it's different than depression. Depression usually is associated with low mood. In apathy, patients don't necessarily feel low mood. Their mood is usually neutral, but they just lack this motivation. And so a lot of the times it can be mistaken for things like laziness. The caregiver often uses expressions like, my husband doesn't care, he doesn't start things or finish them anymore, he seems very quiet and withdrawn, he seems bored, he sits alone all day and does nothing, he really doesn't have any enthusiasm when we get together in family gatherings, he just seems pretty like he just doesn't care if he's there or not. And sometimes also there's a description of patients looking like they're a couch potato. Next slide. So it's kind of this, I don't really feel that great. It's sort of neither here nor there. Next slide. And there's some consequences of apathy that can be pretty remarkable for Parkinson's patients. So people will describe that they have a decrease in their activities of daily living, that there's more caregiver distress. Sometimes, this can really affect their relationship with their caregivers and their family. Sometimes there's a poor outcome of disease, and compliance with medication can get not so good. And if you're in exercise classes, often people will have a worse rehabilitation outcome. And because of apathy and people don't feel like going out, they can become more socially isolated and decrease in terms of their physical fitness as well.
So what can you tell us about, the burden really that has been brought about by this COVID crisis, and what does it portend for people with Parkinson's disease?
Yeah, so I mean, I think that we've already had worries about some of our patients when it comes to things like social isolation and the stress of day-to-day life and the stresses of being increasingly inactive during even pre-COVID timeframes. There's really a global pandemic in our world of people feeling lonely and feeling socially isolated. And this is something that I think we're seeing a lot in the literature now. In normal aging populations, there's a sense that loneliness and social isolation actually increases your risk of something bad happening to you, more so than if you smoked 15 cigarettes per day, more so than if you had issues with having obesity and hypertension. So there's a lot of risk for social isolation with in normal aging populations. Now, with this COVID crisis, we have patients who often were going out and exercising in group classes. Some of them were involved in using physical therapy and connecting with in-person social networks such as support groups. And this has really, really not been happening in many of our patients. Many of our patients and their caregivers are stuck in their own homes and are spending largely 24 hours a day with each other. And so this is, creating a lot of stressors. And so we have patients that were already at risk for being socially isolated, already at risk for becoming physically inactive. And this is now compounded now with COVID. So I think that this pictorial is taken from an article written by Professor Bas Bloem, who is in the Netherlands. And they've been looking at possible strategies to try to help with this crisis using things like virtual support groups like this one has been something that they've talked about, like socializing online. Many people are trying to do Zoom chats with their friends, maybe virtual happy hours, and often trying to use home-based exercise workouts, if you can use a video. Some of physical therapists are even converting some of their group sessions to virtual sessions. And then there's also possible applications for things like mindfulness meditation or even yoga to help with the stresses of this COVID crisis. And so I think we have to be proactive in looking to help our patients, because I'll describe to you in the next couple of slides what the consequences of social isolation and loneliness have been in our Parkinson's patients, as seen by a recent study that I just submitted for publication. Next slide. So here's a just a pictorial from this recent publication that we just submitted. And if you look at this slide here, we show things that benefit Parkinson's patients on the left-hand side. So things like at the top here, exercise. If you look at these negative numbers, these are things that are positive for Parkinson's patients and their quality of life. And you look at as you go down, you see that loneliness is as bad for you as exercise is good for you if you exercise 7 days a week. And so you can see that it's really a risk factor for patients doing poorly with their disease. Next slide. And so looking at this a little bit differently, you can see if people reported that they were lonely in this red line, that they seem to do worse. And if patients with this green line said that they had a lot of friends, that they seem to do better. And so really we see that these social health determinants seem to predict quality of life really quite well. And with the COVID-19 crisis, we have an increased risk of an already isolated population getting even more isolated. And so I think we have to take proactive measures to help our patients and their caregivers in their homes. Next slide. So I've been working on a virtual support group with some colleagues of mine. This is an organization run out of Tucson, and we do virtual support groups 2 times a week, kind of like this one. We have invited guests, and we've been doing this on a range of topics, starting, actually, if you see here, one of our first topics was back in March 18th, and we had a speaker speak on physical therapy. We've had a whole host, you can go to the next slide, of presenters. And you see here that they're all on YouTube just like these, and you're welcome to check these out if you like. We've had mindfulness teachers, we've had fellow neurologists, psychologists. I think we're at about 20 talks now, and we hope to have Dr. Chitnis join us as well in the next month or 2. But you can see that this type of connection with other people is actually very helpful. And I think that this is a very useful use of our technology, and I think a bit of a silver lining to try to connect us a little bit better. And Dr. Chitnis and I have been involved in education using similar technologies of not just our patients, but also connecting providers from all over the world together to share ideas about helping each other with getting through this crisis and helping our patients through this crisis as well. So I think that even though we're all physically distanced in COVID, I think some of the silver linings are that of this connection through technology. Next slide.
So, so we always hear about this thing called integrative medicine, and I want to know first that how did you, as a movement disorder neurologist, jump, not necessarily jump ship, but switch gears and decided to get into integrative medicine, and perhaps you can tell us what it really means.
Yeah, so I think people are unclear what this term means. Integrative medicine is basically a medical approach to care of a patient that looks at this definition. Then they really use this as a central definition of health, which is a World Health Organization definition. So the World Health Organization is the organization internationally that defines health for doctors. And how they define health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. And so when we think about, this sort of approach to healthcare, it's really more of a holistic, lifestyle-oriented approach, and we'll speak about some specific lifestyle interventions that our Parkinson's patients and their caregivers can implement these days, and in general with helping them with their symptoms of their disease and holistically to live a better life. But it basically is a system of medicine which integrates aspects from other healthcare systems. So sometimes looking at things like Indian healthcare systems like Ayurveda, traditional Chinese medicine systems, and various other approaches, and integrating these along with Western approaches. So not instead of, but integrating them together in order to get sort of the best of all worlds. And I ended up getting into this because I I'd been very interested in my own personal life, using yoga as a way to balance my mind and body. After I finished my training in fellowship, I had my first child, and then I had a number of kids over, I had 3 children total over the span of 7 or 8 years. And I was working part-time and trying to balance being a mom and a healthcare provider. And it was quite stressful. And I ended up getting interested in yoga and using it in my own personal life. I also was seeing a number of patients. I practice in Southern California, and I saw a number of Parkinson's patients that just seemed to be doing very well overall with their disease. And I noticed that many of them were using yoga in their own day-to-day lifestyle. And I was quite intrigued by this. So I ended up getting more interested in yoga. I did a 200-hour teacher training in which I spent 100 hours and then another 100 hours about 6 months later in a row, learning over, I think it was like a 10-day session. It was very, very intense, times 2. And I really was able to understand sort of the inner workings of what the practice of yoga was, what the background of yoga was, and learn more about sort of the sort of benefits that I could glean from using this approach with Parkinson's patients. And as you've already heard, I've been interested in using yoga as a modality to help our patients and to train yoga teachers to work with our Parkinson's patients. So I did this yoga training. I then went on and did some mindfulness training at the VA. The VA hospitals have actually been very open-minded to some of these integrative approaches. They have an approach called whole health, in which they think about the holistic approach to patients of all sorts. And I think this approach works very well for Parkinson's patients, and really talking about some of the lifestyle elements that we'll be talking about. So I urge you, if you are a veteran with Parkinson's, to seek care at a center of excellence if you have access. There's about 6 centers of excellence in the country. If you don't happen to live near one, so Dallas is the closest one in the Texas area would be Houston, but there's sort of specialty areas around, like a consortium network of people that work with these centers of excellence. And so I believe you have one in Dallas at the VA. And many of the VAs have a pretty amazing approach to this whole health as well. And so many VAs offer things like yoga, Tai Chi, they offer meditation in some centers. And so it's really important that you reach out and try to find out what your benefits could be through the VA so that you can get connected with some of these amazing opportunities. So I told you a little bit about my training in yoga and mindfulness. I ended up learning more about Ayurveda and some traditional Chinese medicines and things like that. And I ended up having enough hours to take a board exam to pass, to get board certified last year. That was the last opportunity to do such a mechanism of getting boarded. Now you do a 2-year fellowship at a certified place to get a training. And so this is in addition to basic medical training and residencies. So I ended up doing that after a number of years of being a Parkinson's doc, and I felt it was a really helpful way for me to understand what all is out there, and I can advise people a little bit more holistically, a little bit more intelligently about some of these approaches.
Indu, if I may just interject here with a couple of questions on that topic before we move forward. We got a question here regarding the VA. The participant says, we are 100% connected and go to the Dallas VA, but no one has said that there are yoga or other things to do to help with PD. This is a caregiver. Her dad has Parkinson's. How do you convince the patient to go is the question. Any suggestions on that? Her dad is also dealing with depression and the apathy problem that you mentioned earlier.
I see. So I would just look up on the Whole Health website about, they should have all the locations listed, and find out what the opportunities are that are closest to you. I think you can search by zip code, and then you can look for the closest VAs that maybe just like there's a Parkinson Center of Excellence, there's actually these whole health centers of excellence in the country. They're called flagship sites. And so you might want to look at the offerings and see where the nearest place is. And there probably is something going on. That the hope is to have many of these things at every VA eventually. So I'm not exactly sure what's happening at the Dallas VA, but I bet you there's at least a few things. I would look up the whole health page on the va.gov. And then I would look up what's available at your local VA.
Thank you.
And so, Dr. Subramanian, what kinds of treatments do you want, the patients to be aware of? We're always worried about drug interactions with known drugs, and you can certainly look them up. But, there isn't always a lot of information about interaction with like supplements or herbs and things like that. So perhaps you can share with us your experience and what you do. look at?
Yeah, I mean, I think there's been a lot of worry about broaching the topic of integrative medicine in Parkinson's disease. And I know a lot of traditionally trained Western doctors are very cautious and very skeptical about a lot of these treatments. What I hope to open your eyes to a little bit through the rest of this talk is that integrative medicine is more of an approach. It really involves basic lifestyle principles, and we'll be hitting many of those. I think in general, there are a number of things in this treatment arena that you have to be aware of. And I think that, you know, I will be the first one to tell you that if something sounds like a cure or miracle, if it's only available outside of the US or Europe, if it's very expensive treatment or profit driven, if there's infomercials on the internet or TV or social media about them, and really you're not able to find them in any clear medical publications, or if a provider who's touting some sort of integrative treatment asks you to stop your conventional treatments, then I would really question, you know, this type of integrative approach. This is not what standard integrative approaches are supposed to have. And certainly, you know, I think these sorts of practitioners who may be out there, you need to be cautious about. And it's really, I'll put the last slide up in this small couple of series of slides, talk about communication between you and your provider. I think you should be wary of these sorts of things that are touted as this. I'll also tell you a couple of other things to worry about. And I think it is important to realize that, you know, integrative medicine practitioners are, there's many types of practitioners out there. And I think, you know, we're really just trying to get an approach to how to, you know, handle all the information overload that a lot of our patients are feeling. And I will tell you that, you know, in some recent statistics of Parkinson's patients in the US, 60% of them were using some sort of integrative medicine modality, whether it was yoga, whether it was a supplement, whether it was some other thing, Tai Chi, acupuncture. 60% of our patients are using this, and they're out there using this every day or possibly on a relatively regular basis, and often they aren't communicating with their doctors. And so whether or not we as Western trained doctors want to recognize this type of approach, our patients are using these things. And I think it's very important that we be open-minded to be able to discuss this with our patients, because the worst thing, and we'll see in the next slide why this would be bad, is to have patients undergoing some of these treatments without speaking to our Western doctors about it. And that, you know, we're basically having two different sides of a medicine being practiced in the same patient without each understanding what's going on. And it can really lead to some dangerous consequences. Let's go to the next slide. So when we think about these supplements and herbs, we have to remember that, you know, a lot of things that are quite potent that we use in pill form actually came from herbs themselves. So we have the ability for some of these things like St. John's wort, which some people use, can actually interact quite potently with regular medications that you use. Many of these herbs are still metabolized or broken down by the liver or kidney, and they can affect these organs and cause damage to these organs. So it is important to understand that just because you're taking herbs, it doesn't mean that it can't affect either your medications or the end organs that are processing these. It's also important to realize that some of the even vitamins can actually cause certain types of problems if they're taken excessively. So vitamin B6, for example, if you take too much of it, can cause nerve damage and cause your nerves to be dysfunctional. So again, very important to be cautious when you're using some of these things. In terms of side effects, some of these herbal preparations can actually have side effects that can be harmful to your safety. So for example, people ask me often about marijuana. Sometimes marijuana can cause sleepiness, and it can actually cause apathy in some patients. And this can compromise your driving or decision making, and the apathy can make you less motivated to exercise. So it's important to think about the possible side effects and when you're taking these preparations and what you're trying to get done in your daily life. It's also important to realize that many of these herbs, when we talk about them being beneficial, that they are often studied in a healthcare system, like in Ayurveda. This is really an approach or a lifestyle approach to living. And so this not only includes just the herb in a pill form, it actually includes sort of the holistic approach to lifestyle. So with Ayurveda, for example, there's a diet that goes along with it, certain approaches to sleep, certain approaches to certain movements, like in yoga and exercising through these sorts of movements. There's meditation, many other sorts of a whole number of approaches that are involved in this healthcare system. And so when we're talking about something like Mucuna being beneficial in an Ayurvedic approach, it's actually as it's taken within this holistic plan. And for example, when we're talking about turmeric, many people say that turmeric is good for the brain. And it's really important to think about when we do studies and we're finding that these things are beneficial in our patients. Many of the times, if we're looking at a culture that uses turmeric, for example, we have to realize that the turmeric is actually incorporated in food when it's cooked in a fat, and it's often cooked with things that make it absorb better, like black pepper or cumin or ginger. Many of these things are in curries that we eat, for example, in an Indian diet, and are really consumed in a very holistic meal or diet plan. And so it's not just the turmeric powder in a pill that we're talking about. It's really this sort of benefit from this whole food, holistic diet preparation. And then it's also important to realize that many of these approaches are not FDA regulated. And so when we think about supplements and you're talking about, for example, cannabis or other things that we may get at a health food store, for example, it is very important to realize that much of this is not actually FDA regulated. And so you may feel better one day with one preparation and try to go back and get the similar preparation the next week, for example, with cannabis. And often these are not standardized approaches to preparing what you're taking. And so really you're kind of on your own with respect to what's actually in some of these preparations. Next slide. And so I mentioned to you about trying to communicate well with your doctor. And I think most of us who are interested in integrative medicine who have a background in Parkinson's, I realize that there's definitely a very important place for using conventional therapies such as Sinemet. I think that, using levodopa is absolutely important. And I would not advise people to either spare it and use something else in place of it, or to get off of medications once people are on it. It's really about thinking about what are the unmet needs of our Parkinson's patients using our already standard conventional therapies, and then possibly look at some of these unmet needs such as non-motor symptoms, and possibly look for approaches in the integrative universe that may be helpful to our patients. So I think it's very important to stay on your conventional therapies. We as integrative therapists who are interested in this field of movement disorders from an MD approach would not advise stopping conventional therapies. It's important to communicate with both sets of your providers. If you're taking herbs and supplements, make sure you list them on lists of medications for your doctor and pharmacist to understand about, and have the Western medicines in a list to show your integrative providers. It's also important for all of your healthcare providers to be communicating well. So if something's done, it's important to just change like one thing at a time so that there isn't a confusion if there was a new side effect from a supplement that you might have taken and you also changed one of your standard Parkinson's therapies through Western doctors. Sometimes it gets very confusing as to what's helping and what's hindering. And you also want to include your standard Western doctor in any conversation about thinking about the risks and benefits of an integrative approach, because they can sometimes be helpful in choosing what approaches to try. So I would definitely, communicate well. We don't want people to get harmed, and we certainly don't want people to stop their conventional therapies. Next slide.
So what kind of, somebody that has a chronic disease such as Parkinson's disease, besides, the medical treatment for the disease in itself, are there any other approaches that you could take, to health and wellness that would actually help these patients?
Yeah, absolutely. So I think when I approach Parkinson's, I want to think about it in a very consistent lifestyle approach. And I think, when we're talking about COVID-19, I think some of these very practical approaches is still very applicable. So I mentioned to you about this holistic approach from the World Health Organization, not just the absence of a symptom or the absence of a disease. It's really thinking about this sort of global approach to mental, physical, and spiritual well-being that really is sort of the definition of health. And so when we're defining health, I think it's important to think about our individual goals of care. When we think about our individual patients, each of them may have a purpose that they want to find them. And I think it's really helpful for each of us as healthcare providers to understand what the goals are for our patients, what their purpose is, what their priority is in getting healthy, and what brings our patients joy and well-being. So each person, it may be very different. For some patients, it might be playing with their grandchildren. For some people, it might be the goal of walking their daughter down the aisle. For some people, it might be to keep traveling with their loved ones. I mean, everyone is very different in terms of what they feel brings them a sense of purpose and what brings them joy and well-being. So I want to think about health in a different sort of way that's a little bit more holistic, a little bit more out of the box. And I think we in Western healthcare perhaps have not been asking these questions. The whole health approach definitely incorporates some of this, as I mentioned at the VA. So definitely think about these approaches. Next slide.
Also, Dr. Subramanian, we're going to take a pause for a second, and Shelley has a number of questions from participants. Go ahead, Shelley.
Yes, thank you, Dr. Chitnis. One of the questions that came in was about vitamins. What would be considered a high dose or too much of vitamin B6?
I would have to look that up. I don't actually know. I think it's about 100 milligrams. So we can look that up while you guys are asking me the next question.
Okay, and this can be directed to both Dr. Chitnis and Dr. Subramanian. The question is, what are some suggestions as a caregiver to help the patient deal with apathy?
We're going to be talking about that in the next few slides. So why don't we reserve that for a minute.
Wonderful. Well, that's all we have so far, so we can keep it going, and I'll interject when we have another question.
Okay, that sounds good.
So,
still looking up the B6 amounts.
And we can do that while you talk. I can certainly look it up.
Okay.
It's not something that we use on a very regular basis.
No.
Okay,
it's about the recommended dietary allowances for B6 is about 1.5 milligrams. So I'm not sure in pill form. Yeah, we'll have to look that up exactly. But some people think more is better in some of these situations and end up overdosing. So so we can definitely look that up.
So in Parkinson's disease, we think about motor symptoms. But we also think about non-motor symptoms. And one of the things that's really important is cognitive issues, mental issues. So what strategies can you tell us that would help patients stay mentally active?
Yep. Okay, so I just found it. Chronic administration of 1 to 6 grams oral pyridoxine per day for 12 to 40 months can cause severe and progressive sensory neuropathy. So you definitely do not want to get above 1 gram. But I think the usual supplements are about 100. So it's saying, 100 milligrams, like I said. So tolerable upper intake levels for people above age 19 are 100 milligrams. So you don't want to go above 100 milligrams. And certainly, above a gram is going to cause some serious damage. So I think that, I'm going to start sort of just talking about some lifestyle approaches, and we can address these individually. Thinking about keeping the brain active. I always tell patients to stay mentally and physically active. Some things that we can do to stay mentally active include things like crossword puzzles and Sudoku. I have patients reading a lot, learning something new. It's pretty remarkable. I'm forever inspired by my patients on almost a daily basis. I have a patient who's in his 70s right now who told me that he's just trying to learn some German because he's been inspired by his heritage, and he's in his 70s and learning German. It's pretty awesome. I have a patient who's reconnecting with playing the piano, having played it in her teenage years, and she ended up getting a piano and trying to play, and she's in her late 60s. And so I think, thinking about ways to keep the brain active and trying something new is always important. In the COVID timeframe, I think a lot of people are feeling stuck at home. I know I love to travel a lot. I love to travel around the world and try all kinds of new foods and things like that. I've been kind of homebound. One of the things that I've been able to stay mentally active doing with is reminiscing with old photos of trips and family events. And so, maybe organizing some of these in a way, maybe writing a story, writing a diary, perhaps of what you've done. Some of your highlights can be very stimulating sometimes, just to look through these old photos. And then thinking about doing something productive. So it might be, trying to organize a collection of something. And I think the one thing I would say is, I know a lot of people are being extremely productive, and we'll have a couple of slides coming up about this towards the end of the talk. But I think it's important to think about setting small bite-sized goals in terms of these mental activities. And just like physical activities, if you try to do too much all at once, sometimes it can be so overwhelming that you really have no place to start. And so I think even if it's, rather than reading all of War and Peace overnight, I think trying maybe a short story, starting with that bite-sized piece, maybe setting 10 minutes to try to read every day. Starting with these small goals can really lead to feeling like you're making progress and staying consistent.
I mean, just on travel, there are a couple of really good websites. One is called Touropia, like Touropia. And then the other one, these are on YouTube, and the other one is Expedia Travel. And they have videos of practically any place under the sun. So if anybody, has a wanderlust like Indu and myself, that's what I've been doing. I've been going to Touropia, and I think it's keeping me, a little happier, because we won't be able to travel for quite a bit. So better believe it. All right. So what are you trying to tell us here?
Yeah. So I think one of the reasons to stay mentally active. So I have a pretty amazing colleague. Her name is Mikhail Moskowitz. She goes by Mickey Moskowitz. And she's somebody that I met in the COVID era. I had seen some things she had posted. She does these beautiful whiteboard drawings, and she's the granddaughter of a psychiatrist and a cartoonist, and she's adopted these genes of both grandparents, and she's a psychologist and a cartoonist now. And what she does is she draws these beautiful drawings to help her patients understand some of these issues that they've been dealing with, with depression, anxiety, grief. And I just want to share a couple of these just to cement some of the thoughts and some of the techniques that we're talking about. So the busier you stay mentally, the more constructive you can be. And the reason that this is helpful to stay mentally busy is to keep our mind off of all the things that occupy our brain otherwise, with worrying and anxiety. And so there, in this COVID timeframe, there's so many things that we can worry about. Are we going to have a vaccine soon? Is there enough food out there? Is enough toilet paper out there? What's to come with all this unemployment? We're constantly watching the news, and there's this barrage of just depressing and anxiety provoking things. And if we keep mentally active, with these focused things that I talked about, coming up with something to plan your day every day and come up with productive things to keep busy with, perhaps this video channel that Shilpa's talking about with the tours. One of my patients was telling me about some cool things on Smithsonian TV, or, watching these documentaries on history on the History Channel. I mean, I think that the less we crowd up our brain with lots and lots of anxiety-provoking news items, I think the better off one will be from an anxiety and mood standpoint. So staying mentally active can definitely be helpful. Next slide.
And so, there are people who really like exercise, and there are people who really wouldn't care for it. But, what I tell patients with Parkinson's disease, that some things are a must. So I like your title that, exercise is medicine, and perhaps you can elaborate more on it for us.
Yeah, I mean, I think that those of us who treat Parkinson's patients realize that they do so much better when they get exercising, and especially starting early. I think there's been some research talking about starting exercise from day one of diagnosis, perhaps connecting people with a physical therapist to get them motivated, or a coach from day one, can really help with how they do in terms of their outcomes. And I showed you that slide about loneliness, and I showed you that panel on the left side showing that if you exercise 6 or 7 days a week, for 30 minutes, that it's as good for you as it is bad for you to be lonely. And so if we can take the benefits of both and put them together, and so if we're doing group exercise, we can actually really double the benefits of that exercise in general. And this is research that I've been doing with Lori Mishley on a CAM-PD survey, looking at symptoms and how people are doing with their Parkinson's disease depending on various lifestyle approaches. And so exercise is definitely something that we've shown makes a huge difference in terms of quality of life over time in Parkinson's patients. And when we think about exercise, I think more is more. So people talk about, how much. So if you can get an hour in, that would be great, but start again with bite-sized pieces. You should mix it up to try to avoid getting bored. If you can do it in a group so that you can stay socially connected and you have accountability, it's very helpful. I know I work out with a group of women every day almost if I can, and they really, we look out for each other. And we say, I noticed that you weren't in that class, where were you? So that makes me feel bad when I haven't been able to, I feel like I'm letting somebody else down. So this is definitely helpful. Trying to get out in nature is helpful. There's, hiking out in the wilderness or out in your backyard with some plants and doing even some walking in circles if you have a big enough backyard. This can be very therapeutic. If you can get a coach or a physical therapist to guide you, that's even better. So when we talk about exercise, people always get confused. They're like, what are all these exercises and what are the benefits of different things? I don't know what to do. I don't even know where to start. And so I like to break it down into these 6 categories of things that can be beneficial through exercise. And if you can hit a few of these categories every day, I think it's very helpful. So one is doing skill-based things. So skill-based things are when you have goal-oriented movement in which timing and or space and accuracy is important for achieving predetermined objectives. So when we think about that, it's things like yoga, Tai Chi. We have certain movements. It's important to move in timing and space, and we are thinking about a predetermined pose, for example, in some of these things, and that can be very helpful. The second is aerobic exercise. So when you get your heart rate up, when you get your respiratory rate up, it's actually very helpful. And in Parkinson's, we've shown that getting your heart rate up can actually help you with sleep. It can help you with your mood. It can help you with all kinds of things. And so if you can get at least 20 minutes of cardio every day, it can be very, very beneficial. And you can get this with all kinds of different types of things. You may not be a runner, so maybe things like swimming, maybe flow yoga, maybe cycling. There's all kinds of things that can really get your heart rate up. Even it might be a Zumba class. So, think about things that are going to get your heart rate up and try to incorporate that every day. Resistance training is useful, and this improves muscle strength and endurance. And then focusing on balance and things like yoga or Tai Chi can be helpful for that. The mind-body approaches, and we'll spend a little bit more time talking about this in a minute. Yoga and Tai Chi can definitely help with that. And then stretching and flexibility. So things that are going to help you stretch. And you can see I'm not biased at all with yoga. Pretty much every single one of these things is helped by yoga, so you see that. But if you don't like yoga, think about other things. We can certainly get our heart rate up doing other things. We can certainly practice balance and stretching and flexibility with other things. So just think about these different categories, see what you love to do, mix it up, and get started. That's the main thing. Next slide.
All right, and I think a lot of patients with Parkinson's disease do have problems with sleep, for various reasons. Either they sleep a lot during the daytime or they're not able to sleep at night. And, so I'd really like to know the importance of sleep and what it can do for you.
Yeah, so we're seeing a lot in aging literature, and a lot of what I'm bringing to you here is actually from the aging literature, including things like the loneliness, social isolation piece, exercise. All of these things are really from aging literature, and then we're borrowing many of these things and studying them in Parkinson's disease. And what we know to be true in aging literature is that sleep is like floss for your brain. So sleep is when we're really detoxifying. If there's abnormal proteins accumulating, this is when they're broken down. And so really, the better we sleep in consolidated sleep, the better we do with our mental state, with mood, with motor function. So it's really, really important to get good sleep. And I think many of us as a society have underestimated the value of sleep. And I think we're revisiting some of these principles. And I know many people are not sleeping well in COVID. They've really got very little structure in their lives. And I think it's really important to try to keep your structure in some way. If you wake up in the morning, wake up at a set bedtime, set awake time and set a set bedtime. Plan your day in between those hours and try to get 8 hours of sleep at night. If you can get good cardio, I already told you that you're going to get sleep better. If you can minimize social media and news as the days going by, it's very helpful. And for some of our patients, we're actually limiting them to 30 minutes per day, if possible, or less of going on CNN or social media. Because I think with COVID, they get so riled up, and especially if you're watching this towards bedtime, it can really prevent you from getting a good night's sleep. So we talked about turning off our social media about 2 hours before bedtime, if possible. And any media at all, including TV, and trying to wind down towards this time frame. So finding a quiet music, maybe taking a warm bath or a warm shower, reading a quiet book, maybe drinking a soothing chamomile tea or something like that. And some of our patients who have sleep apnea, we urge them to really try to use their CPAP, because this is going to help them sleep better and oxygenate better at night. Sometimes we'll add something like melatonin. I would talk to your doctor about this if we're considering it. But again, it's really, really important to try to set these very set schedules. And I think many of our patients, as they get off their schedule with COVID, they become, sleep is one of the first things that goes out the window, and then they really feel poorly once the sleep is disrupted. So like I said, make a routine and make it structured. So we want to exert things that we have control over. And so structure in our day is one thing that we definitely have control over. We're able to try to define a stable, predictable thing for our day-to-day timeline. So waking up, like I said, at a certain set wake time, getting dressed out of our night clothes into our day clothes, setting very regular meal schedules. I think this is very important. Having some activities, and we've mentioned some of these, being somewhat productive, maybe reading a little bit, maybe being a little bit social on, a Zoom chat with a friend, getting outside a little bit, getting some physical activity a little bit, and then ending the day at a set nighttime and winding down towards that time to really try to get the best sleep possible is really key.
Okay, and we always get asked, we always tell our patients things like don't eat your protein right with your medication, and make sure that you wait like an hour before you eat after you're taking your medication. And people always want to know, what should be a constituents of a good diet. But also there is always this talk about, is any of the diet more protective for your brain? And so perhaps you can walk us through, what we can learn about diet.
Yeah, so I don't want to spend too much on this because I think you'll be having some other experts come on about this. But I think in general, we talk about using a Mediterranean diet with lots of colorful, fresh fruits and vegetables. Whole foods, plant-based is really the key. Getting a lot of fiber from your food is also very important. If you can, and we've listed some different things here, I'm happy to share this slide deck with you. Also, if you can get color, it can increase the flavonoids in quercetin, which are good for immune function, and also getting healthy fat. So extra virgin olive oil, which is largely in the Mediterranean diet, eating lots of nuts and seeds is helpful, and high fiber, like I mentioned, because many of our patients have issues with constipation. And so those are really the best diets for people. And then also I want to stress hydration. So many of our patients with Parkinson's can be dehydrated at baseline and have low blood pressure. And so it's really important to try to drink at least, if you can, 40 ounces of water per day.
Depending on, what other comorbidities,
Yep.
kidney issues or heart issues that you basically have. And what about the social connection?
So I told you that being socially isolated or lonely is actually very bad for your health, even in normal aging populations. And so I really want to try to emphasize social connection. This is something that we never have spent much time talking about. There was just a book that was written by our old Surgeon General, Vivek Murthy, who I'm a big fan of. And he's been really emphasizing this pandemic, a global pandemic of social isolation and loneliness in our populations across the world. And I think we have to, with COVID-19, be much more vigilant about this. So it's really important to think about who you can socially connect with. Some people get stuck with the idea that whoever they married is their only social connection. And so when they're with somebody 24/7 and driving each other bananas, they really don't know who else to reach out to. So I think you want to think outside the box. It might be your best friend from high school. It might be your neighbor. It might be somebody else who you can pick up the phone and talk to get some social connection. You want to find your cheerleader, find your confidant, find your tribe. It's so important for us to socially connect and discuss our feelings, especially when there's a lot of anxiety that we're feeling or depression. It can really help just to talk about it. And one of the things that we've missed about understanding about social connection is that it's actually an absolutely integral and important basic human need. So just like food, just like water, just like shelter, social connection for humans is a basic human need, and we've really underestimated how important this is in our day-to-day lives and in our wellness. So finding, out who's in your neighborhood, finding out who, is in your tribe, and trying to connect with those people is really important. If you can join a support group like this one online, if you can find an exercise group online, some churches are meeting online right now, so reach out and find out what's out there. I think sometimes it's helpful to realize that we are sometimes not the most isolated person on our block. It might be our neighbor who's even more isolated, that doesn't have access to the internet, does not have a computer. And maybe just picking up a phone and reaching out to perhaps a neighbor or somebody on a support group that may be more isolated than you can actually make you really feel good, because you're volunteering and connecting with somebody, and it can make you feel less lonely and actually help another person too. So really think about that. We've been doing Zoom happy hours and coffees with my family and with friends, and it can actually be a great way to connect with people. So I really urge people to think about that and see if they can arrange that. And then even reading a book to your grandchild, if you're normally spending time with them face to face and you're really missing that, you can use FaceTime or Zoom and you can read a book. It's actually a great way to connect with your grandchildren as well.
And guess you can tell us a little bit about the mind-body connection and how this integrates with each other.
Yeah, so I think the mind and the body are very connected. And I think this is another thing that we have spent very little time understanding. And I think in the COVID era, you just saw that there was mindfulness on that slide in a publication by a very Western trained neurologist who's a Parkinson's expert. And so we're realizing that these things can make a huge difference in terms of our mental health. And so meditation is not something that's super easy, but there's a lot of apps out there. There's a lot of introductions to meditation. I would urge you to try to get started. And even if it's for 5 minutes or 2 minutes, just try it and get started and see the benefits. There's also a lot of ways to feel better by sometimes writing lists of things like gratitude practices. So I sometimes wake up in the morning and think about the 3 things that I'm most grateful for. And starting my day with that has actually helped me do better and feel better. Thinking about ways to be more kind to yourself and to the people around you. We'll talk a little bit about that in an upcoming slide. Sometimes listing out the things that you have control over and the things that you don't have control over can actually be quite helpful. Sometimes journaling. There's a number of breathing exercises that can help with helping the autonomic nervous system. So the breath work, which is sometimes part and parcel of yoga practice, in which we're able to calm the mind through our breath work, can be very helpful. I'm happy to give you some resources on that. Being in nature can actually have a lot of benefits to the mind and the body. There's actually research in literature now showing that being in doing gardening, putting our hands in soil, being around plants actually has chemicals that are beneficial to the mind and the body for humans. Sometimes prayer is helpful for people. Sometimes things like singing, dancing, music, either listening or playing it. Listening to live music can be very beneficial. And art can be beneficial. So sometimes drawing or coloring those mandalas, some things like that. And then incorporating humor can actually be very beneficial. So things that make you laugh. We've been watching a lot of old British comedy that I used to watch with my parents when I was little, and I've been watching that with my child. Next.
What show is it?
I'm watching Father Ted right now, which is a pretty hardcore Irish show, but I think it's an acquired taste.
Okay, well, in the few minutes that we have, perhaps you can, wind up with this last slide, and then we'll leave some time for questions. So maybe just summarize basically self-care for all.
Absolutely. So I want to think about our caregivers as well. Many of you are stuck at home with each other and haven't been able to interact with other people too much. And so when I talk about self-care, it's really about that sense that we're on a plane with the lack of oxygen. And what do they say? They say, put that oxygen mask on yourself first before you take care of others. And so for not just the patients, but also our lovely caregivers that we care so much about, if something happens to you, we have to really worry about our patients because there will be no one to take care of them. And so it's really important that you think about yourself first. If there's ways to, incorporate some of these tips that we've talked about. So exercising every day, trying to get good sleep, trying to hydrate, trying to eat right, trying to stay mentally active is helpful. It's also important for our caregivers to take breaks and get some alone time if they can. Finding a friend to call every day to check in with them. And if you're really in trouble, reaching out to those, suicide prevention lines, if you're really feeling like you're at the end of your rope, asking for trouble. Many people in this COVID-19 pandemic have really felt at the end of their rope. And so reaching out and knowing to ask for help is really key. This is the one that I want to spend 1 second more on. So it's important as patients and caregivers to realize that that they need to be kind to themselves. I think it's important that each of these jobs that many of us are balancing, I'm a mom, I'm a healthcare provider, I'm trying to be emotional stability for my parents who live in a different country and my friends as well. And this is exhausting. It can be emotionally exhausting just to get through our day-to-day needs and lists of things to do every day. And I think that expecting to do well at all of these is really impossible and can lead to burnout. So I think sometimes it's just okay to be good enough. It doesn't have to be perfect. Sometimes if it's messy, your house a little bit, if maybe the meal that you cooked wasn't the best at your game, that's okay. I think we just have to give ourselves some love and give ourselves some kindness as well. It's important not to compare ourselves to each other. I think Dr. Chitnis and I were just talking about how productive some other folks are right now. And, for me, sometimes just getting up and getting a shower in and making a simple sandwich for one of my children is a big deal on a weekend. I just need to take some rest and really, unwind a little bit. So I think we just need to realize that what we're dealing with right now with COVID-19 is a marathon and it's not a sprint. So if we overextend and beat ourselves up, we're just not going to get to that finish line. It's really important to just pace ourselves. And like I said, take a rest, take a break, sleep in sometimes, get some alone time in. And this is for both our patients and our caregivers and our healthcare providers. So I just want to take a moment to think about the silver linings that we may be able to take away from this COVID pandemic. I think it's important to realize that we have some time to pause and reflect and to be present, which is really what mindfulness is. I think we're realizing how important our social connection is with each other and our global connection is to everyone in the world. I think for me, I've been spiritually a little bit more connected to thinking about our planet and Mother Earth as something that's given me some energy and some time to reflect on. I think we're realizing that we can't do it alone, that we're so connected and that doing what's right for all of us is important, not just right for one another, for each of us. And so thinking about the global holistic view of how we're all functioning as a society, I think much of the things that we're grateful for are also key, like these basic people that keep our nation running, our teachers, our grocery store workers, the people that are delivering our groceries and our packages, like our postal workers. And just as a final thing, from a healthcare perspective, I think we have some ways to really make a difference and reset sort of at this time. And so for those of us in healthcare, I think we've been looking at telehealth as a new frontier to really help reach out to some of our patients. I think some of these holistic practitioners are maybe getting a second glance. And I think that also talking about some things like advanced care planning. So if something happened to me, what would I want done? These are some times that we can have some of these conversations and really sit back and reflect a little bit more. So I think that we, can really take away not just sort of the negative aspects of, anxiety and day-to-day stressors, but really think about this COVID-19 as possibly a time to reset and think about our goals as a global community of healthcare providers, patients, and caregivers moving forward with Parkinson's disease. Thank you for the opportunity to speak to you. I'm happy to take any questions if there are any at this last moment.
Yeah, thank you so much, Dr. Subramanian. Sorry, Shelly, go ahead with your
No
question.
problem. Thank you, Dr. Subramanian. Really appreciate that. Great information. We did get some questions that come in, so I will read those out and we can just get those addressed one by one. So the first one is, what are some examples of amplitude training?
So amplitude training is, so it's in that exercise, it's sort of the, sort of we're taking things and maybe moving our leg out a certain distance and then moving it back. So these sorts of things are, sort of using movement in different sort of maybe starting with lower sort of amplitudes and then moving greater movement, and with time we're moving our body parts farther and farther away. Those are examples of amplitude training.
Okay, great, thank you. The next question is, how can you help your person with PD to actually sleep? This is coming from a caregiver. Her father has excessive daytime sleepiness and is up and down every 3 hours at night. So what are some suggestions you have for that?
So trying to keep a little bit more mentally active in the day, trying to keep more physically active can help. So we should try to keep people busy and distracted and awake in the day. If you're sleeping all day, it's very hard to get consolidated sleep at night.
Very good, thank you. The next question, also from a caregiver, and just for the benefit of the other caregivers who are on this call, how do you convey to friends and family that you have talked to multiple doctors, that you've kind of done everything that you can possibly do for your person with PD, and just convey to them that perhaps some of the questions that they ask might be hinting towards the fact that you're not doing everything in your power? So just to convey to them that we've done everything and we kind of have to take this at our own pace, and every patient is different. Any suggestions for that communication?
Yeah, so I think, we can ask Dr. Chitnis too, but I think what's helpful in some situations where the patient and the caregiver come in together and then there's other random family members that are expecting them to be doing other things. Sometimes having a group visit with that family member and just sort of, in the time frame that you might have a patient visit, having that family member be present and going over things that may have been tried or not tried, or, allowing them to voice things can sometimes be helpful. So having that family member connecting, or if you're going to a physical therapist, having the family member perhaps come to a session, because I think that lack of communication and understanding is often part of the problem. And so including them inside, if they're important to you. If they're not important to you and they're just giving you random, questioning what you're doing, then you can say, I'm really, I'm trying my best, and, I appreciate your advice, but thanks, but no thanks, But if they are in, in the inner circle of loved ones, I think involving them in a patient visit can be helpful.
I think that this comes up a lot, and I think this really is entirely up to the patient. If the patient feels comfortable about sharing and having people, we come from the Indian culture. It's very funny. Like everybody, all 5,600 of your relatives want to know what's going on with you. But I think that it's really up to the patient. If they feel comfortable, if they and the spouse have working things out and they're doing things, I think it is best to say everything's okay. Sorry, I have an amber alert. And then say that, we're not comfortable maybe discussing details. I guess you have to set some boundaries sometimes.
Thank you, Dr. Chitnis and Dr. Subramanian. Next question is regarding apathy, circling back to that. Dr. Subramanian, a lot of the suggestions that you had regarding exercise and fitness and all of those approaches seem to be hindered by someone who is experiencing a great deal of apathy. So how do we go about combating that and getting over the apathy piece of it so that they can then adopt some of those helpful practices?
That's the hardest thing. And I think apathy is one of the most frustrating things that we deal with in Parkinson's, because there's not one treatment. And really the benefits of all of these things can actually improve the apathy, but it's hard to get started. So what I would say is try to set a goal every day, try to stick to that goal. And once the patient, you kind of have to do some prodding to get people to start. But once they start, they actually feel better. And then it sort of is a self-beneficial or benefiting prophecy. But if they don't get started, that's really where the sort of taking that first step on that 10-minute walk, or taking that first step to try to go out the door to getting to that dance class can be the hardest step. And so once you take step one and try to encourage and stay consistent with that, put it on a calendar, be consistent, it really can be beneficial. But that's often the hardest thing, is just getting started.
That's right. Okay, thank you. We've got one more question, actually two more questions. We'll start with this one. Are persons with PD at a higher risk due to disease or medication if they vacation to the mountains or go to places with a higher altitude?
So that's a good question. Actually, there's been some sense that altitude may be beneficial. I know that Boss was actually thinking, Dr. Blom was thinking of doing a study on that. That said, I think many people with PD are at a higher risk of any transition state. So sometimes I find that my patients, if they go travel somewhere and they're in a different time zone, it takes them a longer time to get used to things. So I think that any change in your environment can actually be more affecting Parkinson's symptoms. Now that said, that doesn't mean that you shouldn't go. It just means that you need to take extra time to acclimatize to some of these situations. But I don't think there's any clear data to say that this is a bad thing overall for Parkinson's patients. I would just say, if you're, going to an altitude and then planning to take a trip somewhere or do some extra activities, pad it with an extra day or two once you get there to try to acclimatize more. It may take Parkinson's patients longer, but there's actually been some thoughts that high altitude may be beneficial for Parkinson's patients for whatever reason. We're not sure why. That hasn't been actually studied well, but there's been some thoughts about that.
Okay.
I think Michael J. Fox had mentioned that. I think, when he went hiking, that he had apparently felt really better at high altitudes, but I don't know that anybody knows why.
Interesting. Okay. And we've got one last question. I'll pose it to both of you. I'm not sure if this is something that could be answered without more context regarding this particular person's situation, but they have been on ropinirole, I hope I'm pronouncing that correctly, for about a year, and we're wondering if there are any suggestions for better alternative medicines.
So ropinirole is a dopamine agonist. It is a specific class of drug, and it's probably better tolerated in younger people with Parkinson's. Sometimes we'll use it more for tremor issues because it's a bit of a better medicine. It's in a class of drug that includes things like pramipexole, and there's a few other medications in that class, but those are probably pramipexole and ropinirole. They're the two main ones. One of the downsides of ropinirole is the side effect profile of this entire class. So it does seem that this class of medication can have more issues with cognitive side effects, sometimes cause more sleepiness. There is an increased risk of a disorder called impulse control disorder, in which patients will pleasure seek. And so it's not without side effects. So I'm not 100% sure about your individual situation and what the symptoms are, or even your age and other accompanying issues. But sometimes in certain populations, we tend to substitute ropinirole for, we substitute it with just classic Sinemet, or sometimes lower doses of ropinirole and then add some Sinemet depending on your symptoms. So that might be a strategy to talk to your doctor about. But if you did need ropinirole for motor dysfunction, it's unlikely that we're going to get that motor dysfunction adequately treated with just other approaches like supplements or exercise or something like that. So it's probably going to be a different Parkinson's medication, standard Parkinson medicine that we're thinking about.
Dr. Chitnis, do you have anything to add to that or any other remarks? Those are all the questions we have for tonight.
Yeah, no, I agree. I think that medications is, again, individual things. As Indu said, the age, comorbidities, what other medications they are on, are all the things, drug interactions are all the things that dictate what medicine to be on. I will say that there has been a paradigm shift, and, movement disorder doctors are now, again, starting to use more and more levodopa, carbidopa for management of patients with Parkinson's, and then using the other medications more as adjunct therapy. And I think dopamine agonists have really fallen out of favor in the last couple of years, especially because of the high risk of impulse control disorders.
Okay, very good. Any other closing remarks, Dr. Chitnis?
No, I think this was hopefully very helpful for our population that was here online, and we'll be posting this, I guess, on the YouTube channel for the foundation. And I would really like to thank both Shelley, you, and for organizing, and Indu, Dr. Subramanian, for being here. And I'm sure we'll hear more from you over time. So,
yeah, that sounds good. Thank you again, Dr. Subramanian. Thank you, everyone, for joining. Thank you, Dr. Chitnis. If you're on this call and you are not subscribed to SkyPass Foundation and you want to receive some updates on other events and resources that we have, please send us an email at info@skypassfoundation.org, and we'll get that sent over to you. All right. Thanks, everybody. Have a great night.
Thank you.